Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The purpose of this presentation is to supplement the instructions found in this booklet that is contained in the Whip Mix Articulator, if you purchase one. What we'd like to go through today would be the mounting of the casts on the articulator, which includes a facebow transfer, a centric registration, setting the articulator with the lateral check bites, and then verifying our mounting so that we can use these casts for diagnostic purposes. The first thing that would be necessary in mounting casts on the articulator would be to have a good set of casts. These casts were taken with an alginate impression material. The essential things that we need is good copies of the occlusal surface, the gingival areas of the teeth, and the peripheral areas of the mucobuccal fold. There's various ways of trimming casts for diagnostic procedures. But I think the thing to remember is to try not to get too much base on there. Large bases or trimming of the bases the way that the orthodontic procedures indicate is too much of a base. So we generally take the base, trim it back so that we're right at the depth of the fold, and we don't have a lot of excess material that requires a lot of mounting material when we mount it on the articulator. Now, it's important to keep the stone cast dry. The impression should be taken at another appointment, the bases should be trimmed, and the model should be set aside to dry so that they will be accurate when we try to use them. If you bring wet stone casts together, they will not be accurate. So the first part of the procedure is to obtain a good set of study casts. We want to now transfer the maxillary cast to the articulator. Most articulator procedures have a bite fork, and the purpose of the bite fork is to hold the maxillary cast in relationship to the articulator the same way as the maxillary cast or the maxillary arch is related to the condyles in the patient's head. The bite fork has a piece that fits in the mouth, and then it has a rod that comes out of here for attaching the facebow to the bite fork. We need to have indentations of the teeth on the bite fork. We can either do this by using compound or wax. We can take a sheet of pink base plate wax, cut off a thickness that is about the same width as our bite fork. We can warm this either in hot water or over a flame, whichever is handy. And the purpose of this is to get a sufficient thickness of wax on the bite fork so that we can register indentations of the teeth without going through and contacting the metal bite fork. So by bending the wax, a couple of layers of it, sealing it to the bite fork, we can come up with a bite fork that has the wax in position. Now, although we want to transfer the maxillary cast with the facebow transfer, it is nice to be able to have the bite fork held in the mouth with the patient's teeth. So we put a thin layer of wax on the mandibular part as well as the maxillary part. It's well to try the maxillary cast on the wax to make sure that the wax will cover the teeth. Should be wide enough to cover the buccolingual width of the teeth, as you see here. And then there should be a sufficient thickness of wax. You'll notice that there's a curve, the curve of Spee in the teeth, and you need a little bit more wax in the posterior area than in the anterior area. So now what we'd like to do is to get indentations of the maxillary teeth in the wax. We do this by warming the wax on the bite fork Just warm it sufficiently enough to get indentations of the teeth. And then we will take this to the mouth and get indentations of the maxillary teeth in the fork. Would you open, please? Try to center it on the teeth. Now close, please. Bite right into that fork. Bite, bite, bite. Open, please. And as generally is the case, the posterior teeth will indent much more than the anterior teeth. We need to warm this a little bit more so we can get deeper indentations and pick up the anterior teeth. Okay, just close lightly on that, please. Open, please. Now, it's hard for her to close into the back part of that with that straight bite fork, so I'm just going to concern myself with getting the indentations of the maxillary teeth at this time. Open, please. We chill that, make sure that it's chilled, and then we try the maxillary cast into the bite fork to make sure we have a stable position. This should hold the maxillary cast in the indentations without any rocking or wobbling. We can go ahead and trim the indentations down if you'd like, so that you don't have too much indentation in the wax, so you can see whether it's seated well, but I think you can feel whether that is seated properly. In order to have the patient support this in the mouth with their own teeth, we're going to add a little bit more to this anterior area. The patient was having a hard time closing into this, so we'll add a little bit more wax in the anterior area on the mandibular one and get new indentations of the teeth. The patient is going to help center the facebow on the face, so it would be nice for them to be able to hold the bite fork in the mouth using their own jaw muscles. Open, please. Close. Now we had to add a large amount of wax in this area, but now we have it so that the patient can bite down on it and hold that fork. Bite a little harder, please. Hold that fork firmly against the teeth. Now, another way that it can be done, would you take your thumbs, please? Put your thumbs, bring them out to the side. Open, please. Now, the patient could reach in there and hold that bite fork up with this. Hold it tighter. But then you have the hands in the road, and you can't use the patient's hands for doing this. So we will have the patient bite on. Okay, you can put your hands down. Now close. Bite firmly on that, please. Okay, hold that firmly. Now we take the facebow part. The facebow is a self-centering. It is the type where we put the axis points in the patient's ears. This has been studied and found that this point, by putting these in the ears, is pretty close to an arbitrary hinge axis. There's a rubber band that you can put around the facebow. It goes from this notch around the support here and over the notch on the other side, so that it has a slight tension on it all the time when the patient puts it in the ear. Now we want to center this on the bite fork. We have a toggle here that we need to loosen. This is the part that will slip over the front of the facebow. We need to loosen that, and then we need to loosen the rod that goes on for raising it up and down. So we loosen these two areas. We have the 3 thumb screws on the top of the facebow loosened, and the patient will help us center that on the head. So if you'd reach up and grab those. and gently take those back and put them toward your ear. Just a moment, please, as I start this over the facebow. And then the patient takes those back. Would you come forward just a minute first? Okay. Okay, now take that back and gently put those in your ears and apply a rather firm forward pressure, but not anything that is going to hurt you. And then there is a nose piece that fits on the front of the articulator, or the facebow. And this gives us our height. We raise the facebow until that rests on the bridge of the nose. So we raise the facebow up until that gives us our height, and that rests on the bridge of the nose. And it is firmly placed in the ears. You caution the patient that anything that we do makes a loud sound in their ears so that they don't become frightened. And then we slide this toggle as far forward as we can towards the mouth, but not actually touching the lips. And once we get these centered, we go ahead and tighten our screws on the facebow. Now be sure to counter support these, because you can apply some undesirable torque on the patient's teeth or even on the ears. If those are uncomfortable in your ears, you take them, release those a little bit. Does that hurt a little bit on that ear? Okay. Now we have our height as determined by our point on the bridge of the nose. Now, on the front of the facebow here, would you lean forward, please? The facebow, lean forward more. Lean forward. The facebow acts as a caliper. As you see here, we have a scale. Would you tilt your head down just a little bit more, more. And you see this mark on the front of the facebow, and you see the scale here. We have a small, medium, and large. So this actually measures the width of the head as we're putting the facebow on. And this reads about a medium-size head. And this you want to record so that when we go over to set the articulator, we can set the articulator to that medium head. Okay? Want to lean back? Now you want to turn your head to the side, over to that side. And we notice here the position of the, turn over a little bit more. Notice that this part that goes in the ear extends forward and in the area of the hinge axis. So that if you, a lot of times, if you just stick your finger in the external auditory meatus, let the patient open and close, you would see that the condyle is in pretty close vicinity to that. But that's in the external auditory meatus. The patient has seated that forward without hurting themselves, and we have tightened the facebow on the face. You want to turn back this way? Make sure all the screws are tight. We have our adjustments. We can now get rid of this part. We don't need this any longer. That has given us our height, and that is our facebow transfer. It is oriented on the patient's face. All we need to do now is to take this out of the patient's ear. Open, please. Take the bite fork out of the patient's mouth, and we have our facebow transfer ready to go to the articulator and mount the maxillary cast. We now want to transfer the maxillary cast to the articulator using the facebow. It's well at this time to go ahead and put a ring on the maxillary member of the articulator. The rings are pre-made metal rings, and they should have a good close metal-to-metal fit. But this screws on the top of the articulator. Make sure that it goes down all the way, seats down so that we have a good metal-to-metal contact in here. This is where we want the good metal-to-metal contact. Make sure that that seats down firmly. I have a little trouble getting this one to seat down. Sometimes those holes aren't exactly the way they should be. And make sure that that is tightened down snugly on the articulator. We measured the width of the patient's head with the facebow, the calipers on the facebow, and now we need to set the articulator to that adjustment. As we see here, we have 3 adjustments for the articulator. We have a small, a medium, and a large. The condyle and the setting of the articulator is in the large position. The condyle is in this largest opening, or largest intercondylar distance. The patient measured a medium, so we now need to change this to a medium, and we do that by taking the wrench that is provided in the kit, and we loosen the condyle. We take the condyle out to the large, place it over in the medium hole, and snug it up again with the wrench. Now the maxillary part of the articulator, you notice here that we have washers in here. There are 2 washers that you use for the largest setting. For the largest, we use 2 washers. For the medium setting, we use 1 washer, and for the small setting, we take both of the washers out. So we need to change that. We do that by loosening the screw on the top of the articulator, and that allows us to take this entire element out of the articulator. And we said we wanted to get rid of 1 of the washers, so we slip 1 of the washers off. A convenient place to keep the washer so that we don't lose them is to place them on the inciso pin. There's the other washer from the other inciso pin, or from the other condylar element. Now, we put this back into the articulator. It should fit in all the way. It's easier to read the condylar inclination if we could line the, you see a groove on the washer up with the groove on the articulator. If we line these 2 grooves up, it's easier to set the condylar inclination. And then we tighten the screw on the back of the articulator, and the articulator is set to the medium setting. It is well to mount the articulator with the condylar inclination set at about 30, so loosening the large thumb screw on the top of the articulator allows us to move this up and down, and we set to a 30-degree reading, and we tighten that firmly. Now the facebow can be assembled on the maxillary member of the articulator. There's no relationship of the facebow transfer to the mandibular member of the articulator at this time. So remove the inciso pin so that we can place the facebow on the articulator. The facebow we took out of the patient's mouth is can be opened and closed. You notice that this opens and closes, and we're going to center that now on the articulator. This was the nose piece that we slipped on this bar. It goes on the anterior bar here. This is the nose piece that slips over there, and this rested on the bridge of the nose. We don't need that any longer, so we can remove that. You notice the little rubber band can help keep that in place. And now we loosen the 3 thumb screws on the top of the facebow, these 3 screws, and that allows us to move this in and out. Now, if you notice as you move that in and out, the facebow can move forward and back a slight amount. And this will be non-effective, or it won't have any effect on the positioning of the cast as long as you have the condylar inclination set at 30. So we must set the condylar inclination at 30. Now, it's a rather easy procedure of placing this on the articulator. The little holes in the end of the earpiece, little hole in the end of the earpiece here. rests into the little knob or the little pin that is on the side of the condylar element of the articulator. So all we do is to place this over one of the pins. You can do this by holding the facebow against your chest, just putting the pin in on one side, pulling this out, and putting the pin in the hole on the opposite side. The anterior part of the articulator, as you see, rests right on the anterior bar of the facebow. And then we can lock these screws in place, or lock the facebow in place by tightening the 3 screws again on the top of the facebow. And we now have the proper orientation for the upper member of the facebow. You could set this on a bench, you could hang it on the ceiling, you could put it anywhere you want, and you've maintained the relationship. The relationship you want is between the bite fork and the upper member of the articulator. But to have a convenient mounting jig, we can place this on the articulator. It has no relationship to the lower, and then we just let that front part of the facebow rest on the incisal table. So we have the facebow quickly oriented to the maxillary member of the articulator for the transfer of the maxillary cast. The only other thing we need now is the maxillary cast. The preparations of the maxillary cast that we would need at this time, we would want to go ahead and score some notches. Take your knife, cut some notches in this cast so that if it comes loose, you have a way of seating it back on the mounting. And then just moisten. Now, don't soak the cast. Just take a little bit of water in your fingers and rub it over the base of the cast to moisten the base of the cast. And this is all you need for the mounting. Don't soak the cast and get the teeth wet. So now all you need to do is to open the articulator. We place the maxillary cast in the indentations that we have in the wax. This can be supported with supports if you feel it necessary, but if you use a rather fluid mix of stone, you don't have any problem with mounting this on the articulator. And then we go with our quick-set plasters and mount this on the articulator. We now have the maxillary cast mounted on the articulator with the teeth in relationship to the condylar elements.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.